Well, hello everyone. My name is Daniel, and today I am privileged with the opportunity to introduce Chapter 5 of Ramachandran's book, The Secret Life of James Thibaut, to you all. Specifically, I'll be focusing on the Charles Bonnet syndrome, which is featured prominently in the first part of the chapter. Charles Bonnet syndrome is named after, who would have guessed it, Charles Bonnet. Bonnet was a Swiss scientist and philosopher who was the first person to document the condition. Bonnet documented the symptoms of his grandfather, who began to see hallucinations of carriages and buildings and women dressed in fine dresses around him as his vision deteriorated after a cataract surgery. It wasn't Bonnet who actually named the condition Charles Bonnet syndrome. It was a Swiss neurologist named Georges de Mauzière that named the condition in honor of Bonnet 200 years later. Talking about the actual condition itself, Charles Bonnet syndrome is a psychophysical visual disturbance. Psychophysical meaning that there are psychological and physiological causes to this condition. It is not all just the neurons in the brain or just the problem with the eye. It only occurs to people with partially or severely damaged visions, and it is more common among the elderly. The most important characteristic symptom of the disorder is the complex visual hallucinations that the patients experience. Patients do see simple hallucinations like blobs of colors or just regular shapes, but they're more often seeing complex hallucinations like humans or buildings and moving objects. While it is easy to think that hallucinations are related to mental disorders, patients with Charles Bonnet syndrome are completely aware of the fact that their hallucinations are not real. Hallucinations only affect the vision in the case of Charles Bonnet syndrome, so it is easier for the patients to determine what is real and what is not. This is what distinguishes it from mental disorders like schizophrenia, where the patient is unable to differentiate between hallucinations from their reality. The pathogenesis of CBS is still unclear. Current research, in fact, has not advanced very much from when it was first discovered, actually. Um, while there are proposed theories about the physiology of the condition, none of them have been really proven. The examples that papers use, or the explanation that the papers use, is usually about the sensory input, much like the phantom limb syndrome. That if we lose the eye, if we lose a vision, then we don't have any visual sensory input anymore, which causes this sort of a phantom vision. And the two ways that they explain it is with hyperexcitability and abnormal neuronal activity. Hyperexcitability meaning some people are just more prone to having neurons that are likely to hyperexcite and then send weird signals to the visual cortex. Or abnormal neural activity is an idea that usually the abnormal neural activity in the visual cortex is inhibited by the constant sensory input from the eye. But when it's gone, then there's nothing to stop that, and thus creates abnormal neural signals, and that is represented as phantom visions. The exact site of the abnormal activities is not certain either. A number of areas have been proposed as the cause of this symptom, but none of them have been proven either. And with the most recent imaging techniques, they have found out that the ventral visual system, or the what passage, is playing a role in the hallucinations. They say that when they check the fMRI, at the moment that the patients are experiencing those hallucinations, they see the ventral stream being hyperactivated. It was also a question that came up in the discussion thread that can people who were born blind experience hallucinations of the things that they never saw? And the answer to that is they can't, because people who are congenitally blind have never had that sensory experience, so they have nothing to base it upon. The current research is limited in the field of Charles Bonnet syndrome. There hasn't been a lot of advancements like we discussed before. And the most recent line of researches have been focusing on finding exactly what part of the brain is really responsible for this. However, these studies are limited due to lack of subjects. We do see some significant results, but they cannot be generalized as they only rely on one or two subjects. As a conclusion, Ramachandran describes Charles Bonnet syndrome as something that the mind is making up in order to make up for the reality that is missing from their lives. And throughout the chapters that we've read in Phantoms in the Brain, this idea of brain making up the things that we don't have is seems to be an overarching theme. Phantom limbs are making up for the limbs that we lost. Visual hallucinations are making up for the visions that we lost. And filling up, which will be discussed later by my group mates, is also missing up for the information that we don't see. There is still so much to be discovered about the Charles-Bonnet syndrome, and um, the thing that you learn after researching this is that this system of filling in the void is a lot more complicated than what it seems like from the outside. Thank you.